process, correct?
Yes. All right. So we got the muscles that attach to the coracoid process. You got the pectoralis minor, which also attach to the third and fourth ribs.
Third, fourth, and fifth.
Depress. What's that?
Third, fourth,
and fifth. Sorry.
Yeah.
Yes, I do have that here. The three. And then they depress the scapula, abduct the scapula, and downwardly rotate the scapula because it's all pulling from the front or the anterior side.
Yes.
You have the short head of the bicep, which comes up and attaches to the coracoid process. Mm-hmm. It also attaches to the tuberosity of the radius and aponeurosis of the biceps brachii. The attachment of the coracoid process allows for the shoulder to flex. Then you've got the coracobrachialis, which, see, the other attachment site for that is the medial surface of the mid-humeral shaft.
Yeah. So
coracoid. Oh, I did the coracobrachialis. So I mixed them up. Well, they kind of run the same way anyway. Then that flexes the shoulder and adducts the shoulder. Brings it in and flexes it.
Yeah.
Flexes that way. Yep. And those are the three muscles that attach to the coracoid process.
Yeah. Excellent. All that stuff is excellent. Everybody, this stuff is kind of important because you don't think about the fact that your biceps, which mainly flex your elbows, we don't think about the fact that my short head of my bicep actually helps to flex my arm. So if I had somebody with shoulder problems, this is something I would work. And the coracobrachialis actually can help me with horizontal adductions, can help me with flexions, and we just don't think about it. It's a muscle that goes from the coracoid process to they said the medial side of my arm, and we don't think about that, but if I'm in anatomical position, that's the inside of my arm here, right in the middle. The middle part of the medial side of the shaft, right here, and that's the coracobrachialis. And of course, please don't ever forget the pec minors, because when people have tight shoulders, they're almost always throwing gang signs, and you got to take care of it. Okay, you got to throw down. You got to represent. All right. Thank you, sir. Ms. Pugh, can you tell us about muscles that attach to the mastoid process of the temporal bone?
The mastoid process?
Yes, of the temporal bone. Mastoid process. Mastoid process is a bump on the temporal bone.
Okay. I have the sternocleidomastoid muscle rotates the head to the contralateral side, and the splenius capitis muscle extends, rotates, and laterally flexes the head, and the posterior belly of the digastric muscle opens the jaw when the masseter and temporalis muscles are relaxed, and the longissimus capitis muscle laterally flexes and rotates the head and neck if one side alone contracts, extends the head if both contract.
Perfect. Thank you, ma'am. Ms. Pugh introduced a new muscle to us. She's correct, by the way. The three muscles we've learned so far that attach to the mastoid process of the temporal bone are the sternocleidomastoid, right? Which, by the way, what is the nickname for the sternocleidomastoid? Thank you. Thank you, Ms. Ambrose. Yes. Omnis Patris Spiritus Sancto. Amen. It's the prayer muscle. Yes. And then we got the splenius capitis. Goes out diagonally like an upside-down triangle. Boom. We've got the longissimus, attaches my head to my butt. They all insert in there. And she mentioned something called the digastric, which means two-bellied muscle. It is a very tiny muscle that we will learn about later. It is one of your suprahyoids. Your hyoid bone is a tiny little bone in here. It's a floating bone. It's not attached to any other bones. And there are lots of complicated muscles that hook to the hyoid bone. There's 4 above it, by the way, suprahyoids, and 4 below it. By the way, I hope you notice all these hand signals I'm showing you, because they are very good ways to remember these things. But anyway, you have 4 suprahyoids, and they live kind of up here, and you've got 4 infrahyoids, and they live down there. So anyway, the digastric is one of the suprahyoids, and these are strange little muscles that help you do all these fancy things with your mouth. We don't think about it, but you guys can breathe through your mouth, you can eat with your mouth, and you can talk with your mouth, which takes an incredible amount of articulation. And many of us can do almost almost all three of those things simultaneously, although we choke occasionally when we do it. But still, the point is we can breathe, talk, and eat at the same time. And that requires really fancy tongue and throat movements. And so the suprahyoids and infrahyoids help us with that. And strangely enough, one of the hyoid muscles, one of the suprahyoid muscles, the digastric, actually attaches deep inside your head to the mastoid process. So that's 4 muscles that attach to the mastoid process. This mastoid process is getting very, very important. Just like the coracoid process is getting very, very important. We will be building on that theme later. Miss Rader, would you be so kind, speaking of important areas in the body, to tell us about muscles that attach to the transverse processes of the cervical region, the little guys out here on the side?
Yeah. Give me 1 second.
Take your time, ma'am. And everybody, this is going to be very important because of all the nerves that come out the side of your neck. And we have a slide presentation, and it's beautiful. It's beautiful.
It's taking a minute to come up here for me.
Take your time. This is great. I love the visuals.
Okay, so today we're going to do some review on the muscles that attach to the transverse processes of the cervical vertebrae. First, we've got the levator scapula. Its origin is the transverse processes of the 1st through the 4th cervical vertebrae, and it inserts on the medial border up towards the superior angle.
Yes.
Its actions, unilaterally, it will elevate the scapula, downwardly rotate the scapula, laterally flex the head and neck, and rotate the head and neck to the same side. And then bilaterally, it'll extend the head and neck. Next, we have the longissimus. So this has multiple attachment points, but basically it attaches your head to your butt. For the purposes of this presentation, the cervicis portion of the longissimus attaches to the transverse processes of the cervical vertebrae. And the actions of the longissimus is to flex the vertebral column to the same side. Bilaterally, it will extend the vertebral column. Next, we have the iliocostalis, another erector spinae muscle. Origin is the thoracolumbar aponeurosis and the posterior surface of the ribs, of all 12 ribs. Again, multiple insertion points, but for the transverse process of the cervicals, it attaches to the transverse process of the lower cervicals. Its actions unilaterally will laterally flex the vertebral column to the same side, and bilaterally will extend the vertebral column. We've also got the multifidus and rotatories. These basically run from the sacrum up to the cervical vertebrae. They attach to the transverse processes, and then the multifida is the only muscle that runs across the sacrum. The actions for these are to rotate the vertebral column to the same side and extend the vertebral column. We also have the semispinalis capitis that attaches to the transverse processes of C4 to C5 and then inserts between the superior and inferior nuchal lines of the occiput. And the semispinalis capitis extends the vertebral column and the head. Splenius cervicis, getting full in the transverse processes here.
Yes.
We've got the origin of the spinous processes of T3 to T6 and the transverse processes of C1 to C3. This muscle rotates the head and neck to the same side and laterally flexes the head and neck to the same side. We've got some occipitals here, the oblique capitis superior and oblique capitis inferior that attach to the transverse processes of the atlas, and the inferior attaches to the spinous processes of the axis. They insert the superior between the nuchal lines of the occiput, and the inferior attaches to the transverse processes of the atlas, C1. These help rock and tilt the head back into extension and laterally flex the head to the same side. The inferior, the pedis inferior rotates the head to the same side. Next, we've got the intertransversari. These attach, for the purpose of this slide here, this spans the transverse processes of C2 through C7. Unilaterally, it laterally flexes the vertebral column to the same side and bilaterally extends the vertebral column. We've got the scalenes. Looks like there's 3 of them. They're anterior, middle, and posterior. They basically attach to the transverse processes of the 2nd through the 7th vertebrae. The actions of these laterally flex the head and neck to the same side and rotate the head and neck to the opposite side, and then bilaterally elevate the ribs during inhalation and flex the head and neck. And that would just be the anterior scalene. Finally, we've got the longus capitis and longus colli. The capitis attaches to the transverse processes of C3 to C6, and the colli attaches to the bodies of C5 to C3 and the transverse processes of C3 to C5. They insert into the inferior surface of the occiput. The colli actually attaches to the tubercle on the anterior arch of the atlas and the bodies of the axis C3 and C4 and the transverse processes of C5 to C6. These muscles unilaterally flex the head and neck to the same side and rotate the head and neck to the same side, and bilaterally they flex the head and neck. And I believe that is all the muscles that attach to the transverse processes.
Those last 2, by the way, everybody, are basically found behind your throat. They're in front behind your throat.
Yes, they're between the trachea and the cervical vertebrae.
Ms. Rader, I would love to tell you if you missed some, but the problem is you caught like 17 that I had forgotten about. When by the way, I know the origins and insertions of every single muscle she listed. If you asked me like to tell you about that muscle, I could have told you about it. But when I gave you the assignment, I wasn't thinking about any of those. You made my point even better than I like this one. I got an education out of this. So you're telling me, and she is right, by the way, there was not a single wrong detail in that presentation, not even a little bit. That was amazing. But I forgot. Yeah, the longissimus and the iliocostalis, these 2 erector spinae muscles attached up there, I forgot all about that. I know it, but I just didn't think about it in these terms that they hook up there. The semispinalis capitis, the splenius cervicis, right? The levator scapula, the scalenes, those I thought about, of course. But the multifidi and the rotatories and the suboccipitals. And then you got the colli muscles in front. That's 12, and I still feel like I'm missing other ones that you mentioned. Oh, and the intertransversari, you got the little teeny muscles on the sides. That was amazing. That was amazing. So I'm counting just off the top of my head, and I don't think I repeated everything you said. That's 14 muscles that can be found attaching up here. On each side, everybody. 14. So this is probably the busiest place on your body, muscular-wise. And you've got all these important, like, brachial plexes that come out here and all this kind of stuff. Amazing. Thank you for educating me. Thank you. I'm really serious. That was amazing. Do you have a list of all those muscles that you presented? Yeah, I would love access to that list to make sure it's not more than 14. That was really helpful. I'm literally going to be teaching it that way to classes in the future. Thank you.
Okay, I'll send it to you.
That was awesome. Okay. Well done. All right, we have some real quick review of systems of the body and all that good stuff. Mr. Snell? You there, sir? Hi. Mr. Snell, can you tell us quickly about the integumentary system just so we don't forget about what it is?
Yeah, so it's the set of organs that form the exoskeleton of the body. It has 3 main functions, which is protection, thermoregulation, and sensation. And then the three layers are the epidermis, dermis, and hypodermis.
Cool. We'll leave it at that. If you're cool with that, I love it. So hair, skin, and nails. Yeah, hair, skin, and nails. Epidermis, dermis, subcutaneous or superficial fascia or hypodermis. Vitamin D production, sensation, protection, all that good stuff. Thank you. Miss Stevens, will you tell us briefly about the skeletal system if you're up to it?
Yeah, I can do that.
She's like, I can do it. With my last breath. Just basics. Okay. Yeah.
Okay. So the skeletal system works as a support structure for your body. It gives the body its shape, allows movement, and makes blood cells, provides protection for organs, and stores minerals. Skeletal system, it's a framework that provides structure for the rest of the body and facilitates movement. There's the two parts of the axial skeleton, which is the bones along the axis, which includes the skull, the vertebral column, and the rib cage, and then the appendicular skeleton, which is like the appendages, it's your upper and lower limbs, and the pelvic girdle and shoulder girdle.
Perfect. Good. Yeah. These are the levers of our body. They protect us, and they also produce red and white blood cells. And a whole bunch of other stuff you said, but that's highlights there. Awesome. Mr. Thornton, can you tell us about the muscular system, sir?
Okay, the muscular system is an organ system consisting of skeletal, smooth, and cardiac muscle. It permits movement of the body, maintains posture, and circulates blood throughout the body. Also, the muscular systems in vertebrates are controlled through the nerve system, although some muscles can be completely autonomous. And there's 11 main functions: mobility, stability, posture, circulation, respiration, digestion, urination, childbirth, vision, organ protection, and temperature regulation.
Very cool. Thank you. So, one interesting fact, everybody, Mr. Thornton talked about muscles help with circulation. Obviously, the muscle that really helps with circulation is your cardiac muscle, your heart, right? Mm-hmm. But don't forget that muscles in general help with circulation, meaning, like what do they call your soleus? Anybody remember what they call your calf muscle? It's your soleus. What's the nickname for it?
The second.
Yes. Second heart. Thank you. Second heart, because the walking action of that muscle and it contracting actually helps pump blood back up to your body. So muscles do help move blood around just on their own action, which is fantastic. Thank you, sir. Miss Savarino, you were going to, even though I told it to you 7 times wrong, you were not going to tell us about the integumentary system. You're going to tell us about the endocrine system. It's a huge chapter. You do not have to go into gory detail, but just talk to us about it.
Sure. So some important functions of the endocrine system are hormone production and secretion, regulation of metabolism, growth development, nutrient absorption, energy and metabolism, and stress adaptation, and how the body responds to stress from infection, trauma, and dehydration. But I want to talk to you guys about my favorite gland, the pineal gland. In Latin, from Miss Creo, the word penal means pine cone. There's a lot of symbolism behind this, but that's another discussion. The gland secretes several hormones, but the chief one is melatonin. And this gland plays a role of controlling our sleep patterns and how we make decisions and how we perceive reality. So for peak performance psychological development, the pineal gland must remain healthy. And so this tiny gland serves as our body's light meter, and it receives light cues from our eyes, causing it to produce melatonin that sends several hormone messages to the body. Then that transmits information about the length of the daylight. That's known as the circadian rhythm. But it's also known so much more than that. It's known as the third eye. And this tiny organ was in the center of our brain, played an important role in the French philosopher Descartes' philosophy. He regarded it as the principal seat of the soul and the place in which all of our thoughts are formed, and like our intuition, if you will. So unlike most of our brain, the blood barrier doesn't fully protect it. So it kind of just like sits there and it receives a lot of blood flow from second to the kidneys. Whew, I'm sorry, I'm like my heart's just racing right now. So this
You're doing good. You're doing great.
Thank you. This gland is surrounded and immersed by spinal cerebral fluid, and it causes it to camp out in the tiny area behind the pituitary gland. So sometimes this forms calcium spots, and this isn't the only part of our body that forms calcium. We can be calcified in our heart valves, our joints, and our breast tissue. So a study found in the 90s that was excess fluoride and pesticides from like our water and our air and everything causes it to calcify, and it creates a hard shell called calcification. So what you can do to promote a healthy pineal gland is we can avoid excess fluoride, we can reduce our exposures to EMF because even though it doesn't cause calcification, it limits our ability to produce melatonin. And then creating a healthy sleep environment, really dark, and avoiding like blue lights and LEDs before bed to kind of give our pineal gland a chance to rest. And also indirect sun exposure, sun gazing at sunrise and sunset, and like listening to 526 hertz, which is like our body's. Oh man, it's so crazy. But anyways, if you like look at the sun and like close your eyes and like kind of direct your eyes towards your pineal gland and like look at the sun, it's like a warm sun hug, and it just feels so great. It's just really like honestly just so good for you. And I just want to wrap it up with Dr. Joe's dispense. He goes into this a great summary of how it is. If you don't mind recording this, go to
Please,
the
what away.
It says the pineal gland is a crystalline superconductor that sends as well as receives information through the transduction of energetic vibrational signals, frequencies beyond the senses known as the quantum field. It translates it into biological tissue, the mind, and the brain, and forms it into meaningful imagery, the same as the antenna translates different channels onto a TV screen. Another crazy thing is looking into Fibonacci's constant. If you like map out the brain, literally the pineal gland sits right in the center of Fibonacci's constant. So like the eye of Horus, this thing is so powerful. We're just spiritual beings having a human experience. And I'm just grateful for this gland.
Wow. Thank you, ma'am. I am definitely going to get a sun hug today. Yes.
For sure.
For sure.
I love this book. Highly recommend if you're just. He goes into great detail about energies and creating your own reality and just the power that we have. So.
Woo! All right. Thank you.
Thank you.
Thank you for your passion. Miss Hendrickson, please.
It's just too much.
That's amazing. It's really cool. I just read this article online about how birds can sense the magnetic field of the Earth, and that might play a part in their
Yes.
navigating long distances. Like
Yes.
when they have to go like through a different hemisphere. And they also said that human cells respond to the Earth's magnetism as well. Because they did this study and like they had it fluorescent and they used it like magnet to see if it would respond, and it did respond to it. So I think that's really cool. I think it might have something to do with that skill of I can't remember what the word is for it, but like when people can like find water underground.
Oh, yeah.
So I think that might be like connected, and how we really have. I mean, most people aren't in touch with it, but we might have like crazy abilities that we don't even know about. So.
Oh, I don't think we might. I think we do have crazy abilities we don't know about. We are still developing. Yes.
I'm sorry, one more thing.
Yes.
I wanted to link a video from Dr. Dispenza. He has a pineal gland activation breath exercise, and he explains more into detail about the energy stored and how to clear it. I'd love to link it in the chat for anybody who's interested.
Drop it in the
it's
chat.
Like a 16-minute video.
Drop in the chat. Very
That's
cool.
it.
Thank you.
Guys.
Thank you. Miss Carrillo.
Yeah, I just want to say thanks, Fab. I could tell you're really passionate, and I could tell you had coffee. Remember to breathe. But also, I think thank you for looking up the word, like saying it was pine cone. I really love that people are looking up the words of what they mean. And also, so now when you were talking about like the lights, the blue lights from the screens and stuff. I remember people saying like it gives you headaches, but I didn't realize. I was like, oh no, I'm stressing out my poor little pine cone looking at my phone.
That's right.
My poor pine cone. So thank you, Sam. I appreciate it. Appreciate you.
Thank you. Thank you.
Okay, Mr. Singletary.
Yeah, I don't even know how to follow that one up after.
Well, you've got a totally different subject. You're just going to remind us of endangerment sites, so don't go rubbing people with our elbows in these sites.
Oh my God, Sav, you can be beat big time. Okay, endangerment sites, or sometimes what they're called also as the precautionary sites, are places where a massage therapist could unintentionally or inadvertently cause pain, damage, or injure tissues to our body. Endangered sites can be characterized as inappropriate or insensitive massage pressure being applied to sensitive areas such as the back of our knee, our fingertips, the arch of your foot, and even the funny bone. All these areas have very little muscle or very little fat tissue to protect themselves from outside agents. A few of the endangerment sites that we have become more acquainted with are our stenosis process, which is the bony projection of the posterior back of each vertebra, which serves for the attachments of muscle and ligament. The spinous process is listed as an endangerment site because, as a massage therapist, we can inadvertently press against the wrong area in the posterior vertebra section, causing pain to our clients. To be clear about the endangerment sites, massaging in the stenosis process area is very much appropriate, but we must be very cautious when massaging this delicate area to avoid causing damage or injury to others. Another common area of endangerment sites, which we are very familiar with, is carpal tunnel. The carpal tunnel syndrome, it is caused by pressure on the median nerve in the wrist area when too much pressure is applied. Generally, carpal tunnel is not considered an endangerment site, but if the median nerve is irritated or aggravated, then hard pressure can cause a bad reaction to the wrist and hand nerves. In terms of women who are pregnant, these endangerment sites show signs which should be paid attention to, as pregnant women are much more vulnerable to injuries than non-pregnant women who don't have to consider some of these endangered sites. These areas include, but not limited to, are the ankles, hands, backbone, and the shoulders. For the ankle, just above the left ankle is said to be most dangerous. This area is known to increase contractions of the vagina and the uterus. As Ms. Bauer had told us in class, it can trigger premature contractions in labor and possibly lead to miscarriage. The hands, try to avoid the wrists if you can. Massaging this area can also lead to the uterus to contract. The other area to avoid is between the thumb, your thumb, and the forefinger. It's a term. It's called H-E-G-U. I think it's pronounced higu. This can cause quick and fast labor pains. The backbone, specifically the lower back, the sacrum, and the lower abdomen. Improper pressure to these points can easily cause injury to the fetus and have drastic effects to the unborn child. And finally, the shoulders. Although normally a soothing massage experience, for a pregnant woman, this area could be as an endangerment site because putting too much pressure on the cervix could cause a cervix contraction, which could also prove to be fatal to the fetus. With regards to precaution, an excellent way to avoid endangerment sites is to learn good educational skill sets and how to work safely around these areas of the body that would normally be off limits to inexperienced massage. In a normal setting, a masseuse normally we tend to avoid endangerment sites by exercising the use of broad, flat, or light pressure in these areas, as opposed to more intrusive massage techniques that may cause serious injury to our clients. And again, to be clear, Identifying endangered sites does not mean that the area should not be touched at all, but just to be careful when you're palpitating and massaging our client's satisfaction.
Thank you.
And that's it.
Thank you. Yeah, it's not that you don't massage endangerment sites, it's that we're more careful with them. And they tend to be sites that are bony, don't have fat protection around them. They tend to be the folds of your body. Your elbows, your armpits, and your knee pits, and your groin pits and such. Sir, very respectfully though, I would like to disagree with your comments about the endangerment sites for a pregnant woman. It's very common what you shared. It's very common. It's all over the internet and stuff. But there's just no evidence to suggest that that stuff happens when you press on ankles or anything like that. Just none. So I'm not saying you shouldn't be careful of working on a pregnant woman around her stomach and not overstretching her because she's got relaxed and such. But you can press on her thumb pads and ankles all day long, and not a darn thing's going to happen.
No, all that stuff I looked up in research. So.
Oh no, you're absolutely right. And by the way, most places they're still reporting this because it comes from literature that's been repeated over and over again for hundreds of years. Actually, it's just there's just not a lot of there's not even a crumb of medical evidence to suggest it's ever once happened. And I've even personally had pregnant clients come into me and they're like, I'm past due. Please try to put me into labor. And we've gone after those spots and it didn't work. After those spots. So where I've aggressively tried to put them into labor and it just doesn't work. If it's a healthy pregnancy, there's nothing you can do to make it unhealthy really from a massage point of view, except have them lay on their stomach or their back.
Right, that I got. I wonder why so many articles have that.
Because of this.
I mean, and I'm not talking like one or two. It's just like every single one that I looked up, I'm like, oh, okay.
Here's why, sir. Two big reasons. But remember the book I told you guys about, The Lies My Teacher Told Me? The Lies My Teacher Told Me is a book. It's not about the fact that your teacher is trying to lie to you. It's about the fact that when they write a textbook, they literally go to the last textbook written and look at updating it a little bit and put it back out again because there's a lot of money writing textbooks. And so history books have been done that way for hundreds of years. The next guy is just writing it off the last guy. So if anything's wrong, it just gets carried along for 200 years. It really does. Well, the same thing is true with massage therapy. There's not a lot of research out there in massage therapy. So what happens is all the articles you're reading are because somebody else has read that article and has rewritten it. Does that make sense? So they're just spreading the same information over and over again, but wasn't based in fact in the first place.
Okay. I understand what you're saying.
And it's got great traction though, because we're like, oh my gosh, pregnancy, we don't want to do anything bad, and that's true too. There's also a little bit of this air that when you're pregnant, somehow that is a condition where you are sick and fragile. And that's just not true. I'm not suggesting it's not difficult being pregnant. I can't speak to that. But my point is, you guys, we've been doing this for millions of years. We're all here because pregnancy actually works very well, and it's actually very hard to stop. And so think about it. If there was actually a way to kind of get rid of a child that easily, there would be lots of people utilizing it when they didn't want to have a child. It doesn't work. Yeah. So you don't have to worry about it. I'm not trying to. I just wanted to kind of throw it out there.
No,
That's
I didn't take it that way.
Yeah,
It's just like you look up and research all this stuff, and it's like, okay, I guess it's true.
Oh, I don't. By the way, sir, if you went to several massage schools, they would tell you it was true.
Okay.
But this is kind of what Ms. Clayton was talking about, but there's just no evidence of it, which is why they massage pregnant people all the time and don't even worry about it anymore. It's just not a problem. And that's not just my opinion. There's a lot of new research out to say it's not only is it not dangerous, it's really good for pregnant women, and the real concern is actually how you position them, and that's about it. And that's just because of blood flow. Cool. That was fantastic. Thank you, and thank you for bringing that back up so I could discuss it and debate it. Miss Young, I don't know how I skipped over you for a second, but you were going to tell us quickly about just what is the nervous system.
Yeah, I'm just gonna pull up the slideshow.
No problem.
Yeah, it's gonna load. So the nervous system. Okay, now I gotta do this right. Oh no, not the cat.
Well, cat wants to be involved too.
No, she's loud. The nervous system is the body's communication and regulation system. The nervous system detects stimuli inside and outside the body, interprets it, determines a response, and then expects a response by executes a response by initiating changes in muscles or glands if warranted. The nervous system is divided into systems, subsystems, and divisions. Basic structures and components are the brain, spinal cord, cranial and spinal nerves,
I love it.
neurotransmitter. Important functions: sensory input, interpretive functions, motor output, higher mental functioning, and emotional responsiveness. Sensory input: nerve cells to text stimuli or change inside and outside the body. An example of internal change is lowered blood sugar levels. An example of external change is increased ambient temperature. Nerve cells are called receptors. Receptors detect this information and send impulses along the sensory nerves to the brain and spinal cord. Interpretive functions. The brain and spinal cord interpret sensory input, store some of it, and determine an output if needed. Motor output. Nerve cells in the brain and spinal cord generate and send nerve impulses along motor nerves to efferents.
Efferent. Yeah.
No, I think it's effectors. Yeah,
Oh, effectors, sorry.
Which are muscles and glands. Higher mental functioning and emotional responsiveness. The nervous system is responsible for mental processes such as cognition or thinking, memory, and learning, as well as emotional responses such as joy, fear, sadness, and anger. And that's it.
Cool. Thank you. So, and the reason we could all experience the cat that was not in our room, but was in your room, was because of our nervous system. And our ear sensors literally picked up the vibrations, sent electrical signals to our head. Our head actually interpreted that and said, "That's a kitty cat." And then we giggled. Yeah. The nervous system. Remember, nervous system, central and peripheral systems. The peripheral system has a somatic and an autonomic system. The autonomic system can be further divided to sympathetic and parasympathetic. We are trying to get people into the parasympathetic, where they rest and digest and relax and fight cancer and grow strong muscles and bones and all that good stuff. Thank you, Ms. Young. Mr. Richards, you were going to tell us the proper names of the major joints of the body in the King's English, I believe.
Well, some of them are a little challenging.
Yeah, that's why I gave it to you. I didn't think anybody else could handle this assignment, sir. It was handpicked for you.
I've got to portray my Harry Potter.
Yes.
Right?
Yes, you do. You really do. Tell us like the name of the common name of the joint, and then the Harry Potter name, the Latin name.
Okay, so joints and the medical names. Vertebrae, this is a bit tricky, is the zygapophyseal joint. It's a gliding joint, articular process between the vertebrae. The actions are flexion, extension, rotation, and lateral flexion. Is that what you wanted for the vertebrae, or did you want them all?
I've just actually never heard the term before. I don't think you're wrong. I was sitting there thinking I've never heard this before. I just thought you were going to tell me it was called the intervertebral joint.
No, it said zygapophyseal joint.
I know this word. it's epiphyseal joint or something like that, right?
It starts with a Z. Z-Y. Z-Y-G-A-P-O-P-H-Y-S-E-A-L.
Wait, what is it again? Spell it again.
Z-Y-G-A-P-O-P-H-Y-S-E-A-L.
Z-Y-D-P what?
Z-Y-G.
Oh, G, sorry.
A-P-O-P-H-Y-S-E-A-L.
Zagaphoceal joint.
Mr. Richards, put it in the group chat so he can see it on the screen.
No, I've got it here. Oh.
That's what it said. It said it's a zagaphoceal joint.
Yeah.
Kind of.
Yeah. All right.
Okay.
Very cool.
So
I'm gonna
moving
read it.
on.
Moving on. You're doing fine, sir. By the way, this is my lack of education. Like I just wasn't familiar with joint, but they're talking about just really quickly. It's not a joint I think about very much. Your main joint of your vertebrae are these discs that are between them, right? But they do have little facets too that help them hook together on the sides, and that's what those facets are called. Very cool. Thank you, sir. Continue.
Okay, shoulders. Shoulder is a ball and socket joint, which is the glenohumeral joint or the spheroid joint. The actions of this is flexion, extension, adduction, abduction, horizontal adduction, horizontal abduction, medial rotation and lateral rotation and circumduction. The elbows. Elbows is a hinge joint, the humerohumeral joint, humoradial joint.
Yeah.
The actions are flexion of the elbow and extension of the elbow.
And just so everybody knows, you are 100% correct. There are two joints here. Humeral ulnar joint, humeral radial joint, but we normally just call it the humeral ulnar joint because that's the stronger connection to your elbow. Yeah. Sorry.
Okay. Hips. Hips is a ball and socket joint. This is, I can't pronounce this very well. The acetabulo-femoral joint.
Oh gosh.
Acetabulo-femoral.
No, and hold on. I got to stop. I mean, I know the name of that joint, but now that you've said it, that's stuck in my head. And I'm trying to. It's the acetabular femoral joint. Acetabular femoral joint. I mean, I don't know how you guys say it across the pond, but acetabular femoral joint. I always remember like ass tab, like it hooks your ass to your body. Acetabular femoral joint, because that hole is called the acetabulum, and your femur goes in it. Acetabular femoral joint, or the coxal joint. Yeah.
Its actions are anterior tilt, posterior tilt, and lateral tilt. The knees. The knees is a modified hinge joint. It's the tibiofemoral joint and the tibiofibular joint.
Tibiofemoral.
The actions are flexion, extension, lateral rotation, medial rotation of a flexed knee. The ankles is a hinge joint. It's the talocrural joint and the talotarsal joint. The actions of this joint is dorsiflex the ankle, plantar flexion, inversion, and eversion. The toes. The toes are a gliding joint, intercarpal joint. The actions are flexion of the toes and extension of the toes. The wrists is the condyloid joint, which is the radiocarpal joint, and the actions are flexion, extension, abduction, and adduction. The knuckles is a pivot joint. It's a metacarpophalangeal joint.
Yep.
The actions are flexion of the fingers, extension of the fingers, adduction of the fingers, and abduction of the fingers. And that's all.
Yeah. Cool. So your wrist bones are called your carpals. Bones up here are your metacarpals, and these are your phalanges. So you can have your radial carpal joint, right? Radius to the carpals. You can have your carpal metacarpal joints. Right? You can have your metacarpal phalangeal joints, which is your knuckles here. Your higher knuckles are called your interphalangeal joints or intraphalangeal joints between the phalanges. Very good, sir. Thank you.
I get nervous like Sal. My heart starts pounding. And I'm really good in person, but when you have to do things like this, like I get super nervous. So I turn my camera off. Sab, just an idea.
I-
Camera off. You've got so much pressure.
They say public speaking is actually one of the most fearful things you can possibly do. So there are days that I come in here, honestly, right before I walk in, and I'm like, oh, I have to kind of remind myself, nice group of people, it's going to be okay. I don't know why. There's something about being on stage, in front of everybody. Anyway, I think we all have this fear that it's going to be like this sinking ship, which, by the way, I've experienced before, where I forget what I'm saying in front of a large group and watch the group kind of go, and I'm like, oh boy, and you just watch yourself go up in flame. Anyway, thank you, sir. Well done. Okay, let's take I think that's everybody. Let's take our break here. We'll come back and we will learn about the abdominals. We'll be back at 9:56. 9:56. 9:56. Thank you, thank you, thank you. We'll take it.
Liberty Mutual. Okay, who sat at my desk?
Zygapophyseal or zygapophyseal.
Oh my gosh. 6. Good. Ms. Rader, thank you. I got your thing. I'm actually, with your permission, going to use it in future presentations to students.
Yeah, sure, no problem.
I just thought, it's funny, Mr. Ibarra and Ms. Bauer were actually in the office listening to our thing, so they heard your presentation, and I walked in, I'm like, can you believe I didn't think about all this stuff? And they're like, we didn't either. So we're all kind of, we just have never put it together that way, that there's that much stuff attached there. So when we get to the neck and cervical stuff, I'm going to bring it back up, but I'm also going to use it with future classes. It's just, as a massage therapist, you're very interested in high priority targets, areas where you rub one place and you hit 7 things, and you just named kind of like an area where you rub and you hit 14 things. So it's a big deal. It's very cool. I've never thought about it that way.
Thank you.
Thank you. I'm thanking you. You're not thanking me. All right, let's see. Do we have another? We do. Good. Okay, everybody. We are back. So, I'm trying to think about how to approach this, because there's kind of the nitpicky stuff about where each of these abdominal muscles attach to. But I think the overview is more important. We're going to do both, by the way, but I think the overview is more important to have first. So, hopefully we're all back. Mr. Mall, what are the 5 abdominal muscles? Mr. Mall?
Yes, sir. You said abdominal muscles?
Yeah, what are the 5 abdominal muscles, sir?
Oh, it is external oblique, internal oblique, quadriceps lumborum, rectus abdominis, and transverse abdominal.
Yes. Okay, everybody, please do this with me, because it will help your, unless you are driving a car, then maybe don't do this with me. But for those who are not driving a car and are not going to crash, please do this with me. This is rectus abdominis. Rectus abdominis. Washing the clothes on the washboard, rectus abdominis. Cool? It runs up and down. That's what rectus means. Right? And it's in your abdominal region. It is the muscle that runs up and down your abdominal region. Rectus abdominis. Then there's transverse abdominis. Transverse means across. Transverse abdominis, and it is literally the belt for your tummy. It really is a belt. We'll see that in a second. Transverse abdominis. Cool? This next part's important. If you were to put your hands in a nice cool suit jacket you've got, this would be external obliques. External obliques at this diagonal angle. That means they're not going straight, straight up and down. They're not going straight across. It's diagonal. External obliques. If I put my hands inside each other, internal obliques. This is very, very important because my internal obliques run a different diagonal than my external obliques. They are different. External obliques, internal obliques. If you ever want to figure out rotations of the torso and you don't know this, and Ms. Rader's nodding her head because we've talked about it before, you can forget it. You need to remember external obliques and internal obliques. And then, by the way, quadratus lumborum. It's about this size, right here. Quadratus lumborum. It's about the size of your hands back there. Yeah? Okay. So that's rectus abdominis, transverse abdominis, internal obliques, external obliques, quadratus lumborum. Yeah? Yeah. Cool. Everybody with me? Mr. Lee.
Yes, sir.
Mr. Lee, let's say the 5 abdominals together. Rectus abdominis.
Pardon me?
Rectus abdominis.
Rectus abdominis.
Perfect. Transverse abdominis.
Transverse abdominis.
Perfect. External obliques.
External obliques.
Internal obliques.
Internal obliques.
And quadratus lumborum.
Quadratus lumborum.
That was good. Those are hard. Thank you, sir.
Thank you, sir.
Awesome. Cool. I love it. Okay. Mr. Bose, what are the 5 abdominals?
Did you say my name?
Yeah, I did.
Okay.
What are the? I don't. Yeah, you're right. I'm just calling it random. What are the 5 abdominal muscles?
So you have the transverse abdominals, hold on.
Do you want me to say them with you? I'm happy to do so.
Okay, wait. Transverse abdominals, the internal obliques, the external obliques, and then rectus abdominis, and
the 4-sided muscle found in your lumbar region. It sounds like
I have a brain fart.
that's okay, but it actually means 4-sided muscle found in your lumbar region. This weekend we were up in the mountains driving those 4-wheeled vehicles. What do they call them?
Quad.
Oh, I think that word means 4. So quad something lumbar region. Could it be quadratus?
Hold on. Quadratus?
Yeah! Quadratus?
Quadratus lumborum?
Yeah! Awesome. Thank you, ma'am. Thanks for working through that with me. Quadratus lumborum. Awesome. And by the way, Miss Everson, I love you. Thank you. Miss Everson during that entire thing was like, rectus abdominis, transverse abdominis, external obliques, internal obliques, quadratus lumborum. Cool. All right, everybody. So why are the abdominals so darn important? Because, that's right. It's okay if you answer the question too, Miss Korea. I like that too. And maybe that's what Mr. Thornton is going to do too. Actually, I want to hear Mr. Thornton. Sorry, Miss Korea, but Mr. Thornton, why are the abdominals so important?
Because they support the trunk, allow movement, and hold organs in place by regulating internal abdominal pressure.
Yeah, they do. Actually, well said. We'll talk about that too, sir. Thank you. Well, we got these beautiful bones going all the way down here, right? My hand can run all the way down a bone, multiple bones down the back, right? Let's try it in front. Oh, what happened? There's nothing in here. Nothing in here. Nothing. I mean, there's a lot of important stuff in here, like organs and stuff, but my point is there's no support structure. If I told you, if you didn't know about the human body, and I said, hey, I'm going to make this thing that moves around, and it's going to have this big hollow section in the middle here, you'd be like, why don't you have bones going from here to here? I'll be like, well, I want it to bend and stuff. Oh, okay. But you're going to have a major support problem. You're going to be like, this is going to be the weak link here, because there's nothing in front supporting it. And I'll be like, you're right. So the abdominals really are your core support in front. And what they do is they play off your spinal erectors and back. Essentially, my spinal erectors and back pull me back, and my abdominals tend to pull me forward, and that makes me stable. I'm oversimplifying, but that is a big deal. So let's talk about how we would do that. Have you ever wrapped up a package, for the holidays, you're going to send it off to your family, something, and you put some tape around it one way, but you know how the postal service is. You know there might be some guy there who's going to throw it across the room. So you wrap the tape around it the other way too, right? And then you can put some diagonal tape around it too. And by now you got so much tape, you just figure, what the hell, and you wrap the rest of it with tape too. And then you ship it off, right? You think it'd be funny, right? I do this to my kids when they're in college and stuff like that. You ship stuff off to them like that. It takes them 4 days to get through the tape and open it up. Well, that's what we're going to do with the abdominals here. Yes, Mr. Bose?
What's the pyromedialis?
Pyromedialis?
It's like,
I think it's a very tiny abdominal muscle down here that not everybody has.
okay, so it's like a hit or miss.
It is a hit or miss. It's very tiny. Yeah.
Okay.
Yeah. Way to trip up the teacher, man. Okay. Let's look at the rectus abdominis. We We are going to go over the exact origins and insertions of these muscles in a second with a slideshow. But this overview is extremely important. I'm sorry, Ms. Hendrickson, please.
Yeah, I was just wondering if you could help me figure out real quick, maybe what muscle I might have injured myself, because yesterday, like, I don't know if it was I don't think it was the quadratus, but I was having a hard time standing up straight. So, like, I was kind of like hunched over like this because my back hurt right here. So what muscle do you think that would be that maybe got injured or strained or something?
Quadratus lumborum.
You think so?
Actually, I think it's quite likely. I'm not positive yet, but I think it's quite likely. I'm not blowing it off either. I really just think that would be my first quick guess, because you actually touch that area in about the right spot and everything like that. And the quadratus lumborum can help you with an extension of the back.
Okay.
So,
like right over my sacrum though. So is that lower than the?
Well, the problem with everything down there is it all goes into the sacral fascia.
Oh, okay.
So yes, it could be your lower iliocostalis, your longissimus, your spinalis, all in that area, sure. But the QL is not a bad guess. Yeah.
Thanks.
All four of those are not a bad guess. And those will all feel like it aches down in your sacrum because they pull on the fascia, pulling off the sacrum. All right, so the rectus femoris. The rectus femoris attaches my rib cage to my pubic bone. You can feel your pubic bone. It is above your reproductive organs, not below. I am touching it right now on me. It feels a little sensitive and there's a bone. Right? There. That is this. I am touching this thing right down here. The rectus abdominis really does attach my ribs down to my pubic bone down there. Now, at your pubic bone there, both sides of your hips come together. And they call this area the pubic symphysis. Like symphony, playing together. It's where your two hips come together, and they call this the pubic symphysis. And there's even some bumps on here they call the pubic tubercles that stuff likes to attach to. But, very simply put, you've essentially got this, right? You've essentially got this. Can we see this? Do you need more or less light in here? I don't know if it helps more or less. Let's see. I don't know if that made one bit of difference either way. All right. But that's your rectus abdominis. You don't need to look in the book. What happens if that muscle contracts? What's it going to cause me to do? A flexion. It's in front. A flexion. A flexion of what, though? Mr. Jones.
Is it a flexion of your spine?
Yes, Mr. Jones, it is a flexion of your spine.
Yeah.
Because sit-ups don't really work your abs, do they? Mr. Jones knows that because he likes to work out. He does stomach crunches when he wants to work his abs. And here's an entire movement of stomach crunch.
Oh, it's a very short movement.
It's a very short movement.
What you want to do is pause at the top.
Oh, yes.
Hold it, and then release. And then pause at the top, hold it, and release.
Yes.
Because it's a short contraction.
And what's beautiful about this kind of stuff is when you really understand what the rectus abdominis does, you recognize that you're not even really trying to bend. You're trying to bring your rib cage closer to your pubic bone. Yep. You really are crunching. The minute I'm doing this, everybody, I'm not saying that doesn't work abdominals because I have to use my abdominals, but I'm actually working my iliopsoas. I'm flexing the hip. These muscles do not flex the hip.
Flexors.
Yeah. Those are hip flexors down here. When you flex the hip, it's because you're bending at your leg. This is a hip flexion too. So this just flexes the vertebral column. That's it. Now this is very important amount of movement to be able to do here. This has a lot to do with back strength and stability. But that's what the rectus abdominis does. That's really all the rectus abdominis does. But because it can flex the vertebral column here, it can work with the spinal erectors and back and keep you stabilized. Super important. Yeah? Now, let's look at the internal obliques. Now, I need to do the internal obliques first because the external obliques are going to go on the outside of them. So I got to remember, which way am I going to tape? Let me think. Got my hands like this, put them inside. Oh, so this has to go diagonal going back. Yeah. So, so an internal oblique looks like this. It's diagonal going back. If this guy took his hand, we can't take that hand. Sorry, his hand won't move well enough to do that. But it's going back. It's diagonal going back, going posterior. La da da. Now, Miss Osuna, please.
I just had a quick question on the way you're taping it. Is it like, are you going superficially, or is that accurately on how they're laying over each other? About just the direction.
It's just the direction, really, because what happens is that they kind of weave into the rectus abdominis. All this stuff weaves into this big fascial girdle you're wearing. It is going to be correct that the internal obliques are underneath the external obliques. So when I put on the external obliques, they really will be on top. They really are further out. They're more superficial. But all this stuff up here, no, it gets really wishy-washy. It's very hard to determine what's on top at that point. All right, everybody. I've got something going diagonal. The hips stay the same. If I grab on this direction and grab here to my hip, what's going to happen? Yeah. And do I rotate to the same side of the muscle contracting or the opposite side of the muscle contracting? Same side, yes. Yes. Thank you. And I saw that too, Miss Korea, that you mouthed out. I was just waiting for a couple people. It's the same side, because if I grabbed onto this hip here and started to pull, I would pull myself that way. If I have a diagonal thing going here and it shortens, I would pull. Now it is going diagonal. So can we see that it would have another action if it was working bilaterally? If both these muscles pull bilaterally, can we see that they would still help me do a flexion? Because diagonal muscles are really trying to do two things at once, and we stop them usually from doing one. So if I didn't stop it, by the way, it would actually rotate me to the same side and flex me. It would actually make me do this. If I let the muscle just do what it wants to do, it's going to drag me diagonal, which is a flexion and a rotation. That's what it does. Yeah? Okay. Let's do external obliques. Let's see, hands on the outside. Oh, these go diagonal down to the front. External obliques go diagonal down the front. So that's kind of convenient. And Miss Osuna, these really are on top of the internal obliques. It's just hard in front of the body to talk about what they really do. But they go diagonal this way. And by the way, everybody, these are rough attachments. These are not exact attachments. I have to make this tape stick somewhere. Okay. So, which way am I going to turn with an external oblique? If I grab my waist right here, which way am I going to turn? Opposite side. Thank you, Mr. Overman. Thank you, Ms. Avalos. Thank you, all the other people. I couldn't look at your face at the same time. And if both sides grab, can we see that this would still also help me do a flexion? So actually, when you're doing stomach crunches, you're probably working your rectus abdominis, your internal and external obliques. So, who can tell me, Ms. Hendrickson, please, do you want to tell me? Wait, do you have a question, Ms. Hendrickson? How about, instead of letting me read your lips, you unmute yourself? Yeah? Okay. How about you unmute yourself?
I was like, what? to do sit-ups do anything that a crunch doesn't do, or is it better to just do crunches?
Depends on who you talk to, but it's probably better to just do crunches because what will happen is abdominals are actually very hard to exhaust, and doing sit-ups can be hard on your low back. They're probably not good for you. That's a lot of exercise physiologists believe that now. And when you do sit-ups, you probably exhaust your iliopsoas long before your abdominals really get exhausted. So nothing wrong with doing sit-ups, but it's not a great way to just focus on, to isolate your abdominals. And any good bodybuilder will tell you you want to isolate something so you can exhaust that thing. Crunches are the way to go. Yeah. So who can tell me what muscles I use to rotate to my left? They're going to be working unilaterally, so I need very specific things like this muscle on this side. Mr. Jones, I'm going to rotate to my left. What muscles am I going to use?
Obliques.
Yes, but I need more specifics. I'm not going to use them all. Which obliques and where?
So you're going to be using your external obliques.
Yes, on which side? Both sides?
If you're turning to the left side will contract.
On the external obliques?
I believe so.
Well, let me see. This is my external oblique. This is my left side. I'm going to contract it. That seems to pull me to the right.
You're right. It's because they're diagonal.
Yeah. So which external oblique turns me to my left?
It's going to be the right side to rotate to the left.
Cool.
And the left side will actually be somewhat relaxed during that. Get that?
The external oblique. So is it just my right external oblique that turns me to my left?
No. I would guess that the internal oblique also does.
Cool. On the right side?
Yes.
But I thought my external oblique goes this way. Isn't it going to pull me to that side? I'm getting very confused, Mr. Jones.
Oh man, they're gonna do opposite movements.
Are you telling me that my internal oblique on the left side and my external oblique on the right side? Hey, let me tape something off here. Yeah, they are. I just thought of something. Who can tell me what pretend muscle this is? Somebody raise your hand and tell me.
Transverse.
Miss Hendrickson, what muscle is this?
I think it's the internal oblique.
She's right, because if I put my hands inside, this would be my internal oblique on my left side. Miss Hendrickson, what muscle is this?
That's the external oblique on your right side.
Guys, why are these muscles running parallel?
Do they work together?
Yes. The external oblique on this side actually runs the same direction as the internal oblique on this side, and so they help me rotate. I think it's very cool, sorry. I think it's really cool when you realize, like, hey, this is like you putting your hand on the inside here, but on the outside here, and they run together, and so of course they both grab here and pull me that way. Good stuff. So to turn to my left, I use actually my left internal oblique and my right external oblique. And then I switch them to go to my right. That's really cool. Mr. Ma, please.
So you mean the both sides of the external obliques goes the same direction, right?
No. So this is at the direction of an internal oblique on my left side. This is actually the direction of an external oblique. Maybe I better do different colors. Hold on, let's do this for you. These are both internal obliques, okay? These are both external obliques. Do you notice that the external oblique on this one runs the same way as the internal oblique on this one? They're parallel. Okay. So this yellow external oblique helps this red internal oblique because they actually go the same direction. This red internal oblique helps this yellow external oblique because they go actually the same direction. So they work.
They just try to cooperate. I mean.
Oh, they definitely do. They're synergists. Yeah. When I'm rotating, they're synergists. Yeah. Yeah.
All right. Thank you, sir.
Thank you. So, who can tell me what muscles I use of the muscles we've been talking about? This is not a trick question. What muscles I use to do a lateral flexion of my spine? Miss Rader, please.
So to do a lateral flexion, which way?
To my left again.
Okay, so you would use your internal and your external oblique on the left side.
Yeah, she's 100% correct. Do we see why, everybody? Because if I've got this thing going this way, this thing going this way, and they both contract. One's going to try to rotate me this way, the other one's going to try to rotate me that way. They can't win, so what do they really do? They end up pulling me over. So side crunches are a great way to work your internal and external oblique on that side. Then you got to do side crunches on the other to get that going on too. Excellent answer, Ms. Rader. Excellent answer. Boom. Both these trying to pull me over. Beautiful. Beautiful. Okay. Ms. Abdominals, please.
So the serratus interior feeds into the internal and external obliques, kind of, and I see how it kind of assists with that rotation, and it's pulling the scapula. So it's kind of, I guess, I know that it has to do with the scapula, but at the same time, isn't the serratus interior used in lateral flexion or rotation of the trunk? To some degree.
No, but I really like what you are starting to rub up against. So the reason it doesn't help with that is the serratus anterior hooks into the hips. It hooks into the ribs, I'm sorry. It never gets down to the hips. So you can't move the ribs in relation to the hips unless it gets to them, right? Serratus anterior hooks the scapula to the ribs. But Ms. Ablosh, she's really caught on to something very fascinating that we're going to be studying called fascial lines. And there is absolutely no doubt that the serratus anterior starts to weave down into the external obliques. And we think a lot of muscles connect together in long chains, and those chains can have a lot to do with structural anatomy. So you visually saw, she's right, she visually saw, hey wait, serratus anterior looks like this, and that's kind of what Tapscott's doing with his external obliques. And it is true that the serratus anterior bleeds into the external oblique, yes. I couldn't quite say the serratus anterior actually turns me because it's not down here. But you are right. It kisses the external obliques, and that will be important later. Very important. Beautiful. Thank you. Okay. So then we got a four-sided muscle. Remember seps means heads. This is not a four-headed muscle. It's four sides. Quadratus. We actually have several quadratuses we're going to learn about. Three in this class, I think. But this is the four-sided muscle in the lumbar region. That's the quadratus lumborum. It's back here. Yeah? Let's give it a new color. It essentially attaches your lumbar and your lower ribs to your hips back here. Sorry. So the tape's not very sticky, which is good actually, but because it comes off later. All right. So, by the way, which abdominal muscle is your deepest abdominal muscle? Mr. Richards.
Quadratus lumborum.
Yes. Now, why is the deepest? I can touch it right here. That's superficial, sir.
Because you're from the back and not the front.
Yes. Because anatomical position says we look at a body like this, and from the front, that muscle is all the way through everything to get to it. for a massage therapist, we think of it as superficial. It is superficial from the back, but it is considered the deepest abdominal muscle because we look at bodies like this. Well done, sir. Who can tell me what actions this muscle would produce if it was used bilaterally, both sides? Just by looking at it. Mr. Overman.
It would do an extension of the spine?
Yeah, all day long. He's exactly right. So even though it's an abdominal, it very much is a back muscle. And this is what I like to grab, where I come scraping across somebody's hips and catch it right here and stretch it this way as I pull it into the spine, because I don't want to rub really hard into your kidneys, but I like to grab it from the side and pull on it. Very, very important. If it were to work unilaterally, what kind of action would it create?
Am I still answering?
I don't know, but you volunteered, so please do.
Okay. Yeah. So it would be a lateral flexion to the same side.
Yeah, he's right. So lateral flexion to the same side, or, by the way, that's 100% correct, which is the same thing as an elevation of the hip, by the way. A flexion is the same thing as an elevation of the hip. So this muscle's nickname is what? Who can tell me the nickname of the quadratus lumborum? Miss Carrillo.
Was it the hip hiker?
Yes. It hikes up your hips. You use it every time you walk, everybody. You actually do lift up your leg when you walk so I don't drag it on the ground. Now, I realize we don't actually walk that way, but you probably have seen injured people kind of do this. They're using their hip hiker to get their leg around. So yes, it's called your hip hiker. And it helps you do your little, you guys see me walking down all sexy down the hallway, shaking my hips. That's my quadratus lumborum. I know you've been looking. I can feel it. Okay? So that's your quadratus lumborum. Now when I bend to my left, who can tell me which abdominal muscles I use when I bend to my left? Mr. Overman, please.
Alright, so you'd use your left quadratus lumborum. Let me do the hands to remind myself. This is.
And we're bending, we're not turning. Yeah, left quadratus lumborum.
Okay. And then let's see, to the left. So we're going to the left, and it'd also be the left internal oblique.
Yes.
And the right external oblique.
Well, wait a second. The right external oblique, though, pulls me to the other side.
Did I get it wrong? So internal is this way, pulls it that way.
Uh-huh.
And the right external. Yeah, the right external would pull you to the left.
Wouldn't my, I don't know, Miss Rader, can you help us out here? It's hard.
Reverse.
Yeah, it would be the left internal and external oblique.
Oh, because they both grab here and they pull me over. Yeah, I see where you're going, sir. And if you were doing rotation, you would have been right, sir. Yes, they're right.
I was doing rotation.
So for a left flexion, it's all the left muscles. It's left quadratus lumborum, left internal, left external obliques. Very cool. So that's a lot of stuff when people are having problems in here with their hips rocking and stuff. And we will get people that have elevated hips. That's a problem. Because now their whole foundation's off. Because if my hip comes up on my right side, guess what? My head and shoulders have to shift over to my right side. Because if I don't, I fall over. We do all sorts of stuff to adjust all the time without thinking about it. Okay. So I've got this kind of wrapped up like a Christmas package. Kind of. You know? And I think I do. Let's see. Trying to get this guy to stay up here for a second. Bear with me. Yeah. What could I do? What would happen? Now this guy's got to pick up something really big and strong, and he needs to kind of create like a extra strength around his midsection. What do we do? Have you ever seen how they make barrels? Ever seen a cooper and a hooper? Those are real occupations, by the way. A cooper makes the staves and the hooper makes the rings around a barrel. Barrels, by the way, leak horribly until they're filled up with liquid. They swell and have pressure on the inside of them. They really work well when they're full and heavy because that pressure pushes out, right? The rings hold in the pressure and you've got opposing pressure. Have you ever noticed when you pick up a big object, what you really do is you go, and you hold your breath. You're not holding your breath because you're just holding your breath. You're holding pressure inside your body. You're pushing your abdominals out. And what pulls them back in? What's the hooper? What muscle is this in yellow? Ms. Carrillo.
Is it the transverse abdominis?
Yes. The transverse abdominis is a giant sphincter muscle, essentially. It's a ring, and its job is to squeeze down your abdominal contents as you push them out, and it turbocharges all these other muscles too, because as they tighten up, they become bands. It pulls all those bands together, and now look at this. I mean, this is just tape, but it's doing pretty good here. We've got a lot going on there. So the transverse abdominis, its job is literally like a weightlifting belt. Its job is to give you that ring around your body, and you actually contract it as you push air out in your stomach region, and all the other abdominals contract too. And what they do is it all squeezes down, and that thing cinches them extra tight. And now you've got a rigid thing that can pick up a large object, throw it somewhere, but I can still bend and be all loosey-goosey because I can let it go later. So I can tie my shoes, but I can also pick up a rock because I need to be able to do both. Right? I need to be able to bend over and touch my toes. I need to pick up food from the ground when I'm foraging. I need to be able to do that supple stuff, but I also need to be able to lift another human being up and carry them. And this allows me to articulate in my middle section, and it's why your abdominals have so much to do with your back health. Those are the 5 abdominals. Miss Rader.
But the transverse abdominis is not on top of the other abdominal muscles, right? It's deep to them.
Yeah. So that part is a little iffy. You're not wrong, but what really happens is that I didn't mention in this presentation, there's this big, what they call abdominal aponeuroses. It's a giant sheet-like tendon that all of these weave into. And there's the thoracolumbar aponeuroses back here, and really the transverse abdominis kind of ties those together and sucks those aponeuroses down. And they're all woven in. So it doesn't really matter if it's deep or not because they're all woven into the same sweater. And it does cinch up that sweater. Yeah. And I know it's very hard. We want to think about layers, but think about it on your own bellies. You can't separate out the abdominal muscles. I can separate out my bicep from my brachialis if I want to. Not easy, but I can do it. But you can't do it in your abdominal region because they weave into this really thick fascia that's in front and in back. But the transverse abdominis might as well wrap around all of them because structurally speaking it does. Yeah. Ms. Avalos.
So I've been able to feel and divide abdominal muscles like with people that were pregnant and their muscles divide, and obesity also causes that divide. So when you find someone that's pregnant or obese or has been pregnant, you can actually feel how their core is weakened because of that.
But
you can see it too.
Yes. With respect, I think you're talking about where you see the splitting down the rectus abdominis.
Right.
But you don't feel the layers separating. What happens is the rectus abdominis is in this abdominal aponeuroses, and it starts to actually split apart. She's right. Because it's trying to find the shortest route around my belly. And so it starts to go to the outside here, and what happens is you expose the abdominal aponeuroses here. You're right. But all the layers are still sewn together. But she's right. You split down the middle. Yeah. It's very common. And sometimes you develop a dark line down here when you're pregnant, which is the aponeuroses being stretched and just the effect of the hormones on the body and all that kind of stuff during that time. Yeah. Ms. Hendrickson.
Yeah, there's some, there's a term for that, but I can't remember what it's called, but there's specific exercises that you can do to try to hold them back together because it makes it really hard to have core stability when your muscles are like separated like that. That happened to me a lot. And it was also really weird when I was pregnant, like instead of it being like, you know, like a kind of like this, like it was like a point. Like if I would do a crunch, it was like a bridge, like in the middle of my stomach. It was really weird looking. But yeah, there's a lot of stuff you can do to like fix that. Mostly like hip stabilizers and pelvic floor exercises and ab exercises.
Yeah.
Very helpful.
Very cool. Very true. Very agreed. Okay, so let me show you some quick slides of these muscles now. We'll look at them kind of in a more scientific version. But I think we actually have a fairly good understanding of how they work for you structurally and how important they are. Yeah? Okay. Let me present this. This will only take a minute. Crazy body changes, that's true. Mr. Singletary, please.
Can you leave the skeleton taped up until we get to class today? Because I still have a few questions.
Yes, sir. I'll leave it taped up. You got it. Not a problem. Okay. So, it's very appropriate they're showing us the back because the abdominals actually have a lot to do with back stability, strangely enough. Here, by the way, you guys see that's your thoracolumbar aponeuroses. And that's why it gets very hard to talk about like which spinal erector is on top down here and all that stuff because it all weaves in here. And look at how the thoracolumbar aponeuroses goes all the way down into the glutes. It covers the sacrum, the glutes tie into it, everything ties into it. And you've got the same thing in the front of you in your abdominal aponeuroses. And here's the transverse abdominis wrapping around and hooking in there. You can see the external obliques and the angle they're running here, running to the front. Okay, quadratus lumborum really quickly attaches to the posterior crest, iliac crest, your posterior hips, right? And then it inserts in the transverse processes of L1, 2, 3, and 4. It does not insert in the transverse process L5 because it's too low down here. And it likes to hook onto the last rib, your 12th rib. So it really is a four-sided muscle in the lumbar region. Quadratus lumborum, four-sided in the lumbar region. By the way, as a little side note, this picture has some other really important muscles when you are doing a hip flexion, which are the psoas major and minor, and the iliacus, which are all down in here. But that's inside your hip. We'll get to that later. Quite important. So, posterior iliac crest, back of your hips. Remember the hips, we don't talk about them just as the hips. You've got the ilium on top, the pubic in front, and the ischium that you're sitting on right now. All three of those bones make up your hips. So we call this top part the iliac. This back top part is the posterior iliac. And then it inserts into the transverse processes of lumbar vertebrae 1 through 4 and the last rib, rib 12. Bam. It's not that big, but it's very important, very powerful. It's a great, great picture of its actions here and such. I mean, of its size, sorry. We just did this taping exercise, probably where I got the idea for it. I forgot actually about that. Again, it is very hard to tell what's going on up here because of this rectus sheath and this abdominal aponeuroses. They're kind of really the same thing, the rectus sheath and the abdominal aponeuroses, because everything weaves into it. And if you think the human body is all clean and tidy like these lines make it out to be, that is not the case. It is really hard to tell which came first. It looks like, how do you want to say it? I think we're going to get to go to a cadaver lab, and I think we'll be able to see this. So, okay, here's your rectus abdominis. I said it attaches your ribs to your pubic area, and that is really true. But it really hooks into the cartilages of your 5th, 6th, and 7th rib, and something called the xiphoid process. You can all feel your xiphoid process. It is a little bump down here. It's where your solar plexus is. If you kind of push in there a little bit, you'll get kind of nauseous. It does not feel good. But it hooks to the xiphoid process and the cartilage of ribs 5, 6, and 7, and it goes down and inserts into the pubic crest or the pubic symphysis, which is just the edge of your pubic bones. You can touch that. So, I don't do it on clients because it's too close to the reproductive organs, but you could technically massage down that low. Because you can touch both ends of this without violating somebody. You'd have to drape very carefully and such, but it can be done. Helps with flexion. By the way, it's very interesting what your book says here. It says it helps with flexion of the vertebral column, but it also helps with your pelvic tilt posteriorly. This is important. I don't know if you can see it right now, but when we talk about pelvic tilt, we measure it from the top. Do you remember when we talked about rotation of the scapula? We just had to pick a spot because I was trying to point out to you that, like on a wheel, when one thing goes down, the other thing comes up. So it's very hard to talk about something. So we just pick a spot and we say, hey, this goes this way, we're going to call it one thing. It goes this way, call it another. We do the same thing with the hips. When my top of my hips go forward, we call that an anterior tilt. But notice what happens when I do an anterior tilt. What goes back? My butt. When I do a posterior tilt, what goes away? My butt. So this muscle actually helps with a posterior tilt. It actually helps to get my top to go back. And that, strangely enough, brings the bottom underneath. The bottom goes forward, the top goes back. Or the top goes forward and the bottom goes back. But this is an anterior tilt. You're going to get people come to you, especially with anterior tilts. And the problem with the anterior tilts is they exaggerate the curves of my back and cause all sorts of neck and back problems. Posterior tilts actually start to remove the curves from my spine. It becomes very straight. And you actually don't want a completely straight spine. You want curves to it. It's supposed to have shock absorption. But anyway, a flexion of the vertebra is the same as a posterior tilt. You can't do one without the other. Because the pelvis is getting closer to the hips. And the way it does that is it posterior tilts and you flex. They are the same thing. It's hard to visualize, but they are the same thing. And this is for the same reason that when I'm flexing my humeral ulnar joint, my elbow, is my forearm getting closer to my arm? Yes. But I can also do it this way, and it's still a flexion, right? I can bring my arm, my upper arm, my brachial region to my forearm, or I can bring my forearm, my brachial region. The elbow bends the same, right? I could grab onto something here and do that. Well, the same thing is true with my hips. A flexion here is a posterior tilt, right? Which means extensions of my spine tend to lead to anterior tilt, so that's a whole different thing. Anyway, we will get to that because we're heading towards hips here soon. And hips are amazing. The most amazing thing in the world. Oh my God. The center of your whole body. It's so incredible. Hips are really the key to figuring out people's back problems, not their back. Okay. All right, so we got the rectus abdominis. And let's move on. We have the external obliques. Like to hook to the external surfaces, just means the outside of your 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th ribs. A lot of ribs. And then they like to hook onto the anterior crest of the ilium, the iliac crest, and the rectus sheath, which is also your abdominal aponeuroses. Rectus sheath and abdominal aponeuroses are the same thing, but this is the book trying to tell you that they weave into this area in front. All these muscles we're going to find weave into this area in front. And we already talked about what these things do. Unilaterally, they can help you to laterally flex and rotate, and bilaterally, they can help you to flex and compress the abdominal contents. That's true, kind of all the muscles, but especially the transverse one that we're going to get to here. Here's your internal obliques. It's hard to tell, but they are running slightly diagonal backwards. And they help you to laterally flex and rotate, flex and compress. Yep. They are a little bit lower. And so they hook on to the internal surface of like ribs 10, 11, and 12. And come from your abdominal aponeuroses and insert into the iliac crest. All of these muscles so far, everybody, have really sewn your ribs to your hips, right? They've all hooked your ribs to your iliac crest or your pubic symphysis. They're all about hooking your ribs to your hips because that's how you move the vertebral column there. Boom, boom, boom. And then the transverse abdominis. Transverse abdominis has one action: compress the abdominal contents to cinch you up like a belt, right? By the way, you don't have to hold your breath, and you can actually blow out your breath and flex your transverse abdominis, and you get that real skinny feeling where you can kind of feel like it hitting your organs, and you're creating a vacuum in there. But anyway, this guy likes to, again, connect your ribs to your hips. So it goes and wraps around the iliac crest and attaches the thoracolumbar aponeuroses into the abdominal aponeuroses. You know, it hooks all of that stuff in, all the way down to what's called the inguinal ligament, which is a ligament here in your hips, but it's really sewing in the front and the back together. Front and the back together. The year-end test, by the way, you'll have pictures of these muscles and just be like, can you identify them? And I'm sure you will have a rotating question in the year-end test about when you rotate to your right, what muscles are you using? You know. Beautiful. I don't think I have anything else to say. No. That's the end of my wisdom. That's it. Questions, comments, thoughts, concerns? Yeah. Hold on. Yeah, Miss Carrillo, please.
I was thinking about the hand signals when we do the eternal oblique. What kind of helps me to remember oh my gosh, I'm blanking out. So to help me try to remember which side it goes, when we look at the muscles, I try to think when it's between the ribs and the hips, I try to think which one would win. Like on the eternal oblique, the way they're running like this way, so the ribs wouldn't win against the hip, so it had to turn with it. And then with the external oblique, when it's like the hip and kind of like in the middle, I think the hip in the middle would win versus just the ribs, which is why it would go like rotate the opposite way. I had another thing, but I already forgot. There was a lot to take in here.
It's a lot to take it in here. And by the way, I was using the example, I don't want to confuse people even worse, but I'm using the example of my torso moving because we assume that the legs are grounded. But if I was floating in outer space, or if I was hanging from a bar, these muscles would bring my hips to my rib cage, not my rib cage to my hips. It's the same action though. The same rotations would occur, but instead of me coming here, they would come here. I hope that made sense. Miss Avalos, please.
So I have a question about the pattern of muscles real quick. So when they're in like a horizontal type of direction, are they used more for stabilizing than they are movement or force?
Essentially, yes. The reason I'm saying essentially is I'm sure there's some example of a horizontal muscle that is pulling something towards the center. But yes, I think that is in general true what you just said. Yeah.
So are the stomach muscles used more, or the abdominal muscles used more for stabilizing than they are to produce force? I guess is my question.
Yeah, they are probably used more to stabilize than they are to produce motion, if that's what you mean. Like, I'm not going around crunching with them all day long. You're right. Ms. Avalos is right. Usually what I'm doing is trying to fake crunch while I extend, and so I end up stabilizing. You're right. Usually your abdominal muscles are designed to just contract and kind of hold you there. Yes, I can use them to do these things, but in general what they're using is to give me stability of posture. You're right. They're just in a state of mild contraction all the time trying to hold me steady, yes. But they can be used for movement, but you're right. They are actually considered mostly postural muscles. They help me with my posture. Whereas obviously like a bicep helps me with movement. It's a big movement. These guys do little movements, actually, really little movements, which tend to be postural things. I hope that answers your question. And Mr. Craven, I think I saw your hand up, but I didn't get you in a timely manner.
No, I wasn't sure if you could see me because I had it up earlier too, and I keep forgetting what I'm going to say, but I kind of remember it. But it's kind of for Miss Carrillo.
Yeah.
One thing that helped me, at least, and I hope I'm right, maybe I'm not, but for like the internal versus the external obliques, like as far as like when you're rotating, which one goes